Invited guest, let us pray. Almighty God, who in your wisdom and goodness has appointed the offices of leaders and county assemblies for the welfare of society and the just government of the people, we beseech you to behold with your abundant favor as your servant, who will be pleased to call to the performance of important trusts in this republic. Let your blessing descend upon us yet assembled, and grant that we treat and consider all matters that shall Your Excellency Anne Waiguru, EGH, the Governor of Kirinyaga County, Your Excellency David Githanda, the Deputy Governor, Kirinyaga County, honorable members of the County Assemblies, distinguished guests, ladies and gentlemen. Section 32K of County Government Act of 2012 provides that the Governor shall deliver the annual State of County Address containing such matters as shall be specified in the county legislation. In reference to the above, and through a message addressed to the County Assembly dated 29th day of September 2025, Her Excellency the Governor conveyed her intention to deliver the 2025 annual State of the County Address in consultation with the Assembly leadership and the County Executive, and in consideration that the County Assembly was on a short recess. The date for the 2025 annual State of County Address was set for today, the 11th day of November 2025, at 10 a.m. in the County Assembly chambers. This decision was duly communicated to Her Excellency the Governor and to all honorable members. Honorable members, starting on number 20, paragraph 3, provide that when delivering an address to the County Assembly, the Governor shall be heard in silence, and the address shall not be followed by any comment or question. Your Excellency, it is the customary of this County Assembly to recognize the invited guests seated in the speakers and the public gallery, and I therefore wish to acknowledge the presence of the following distinguished guests. Once I mention your name, you can stand up. His Excellency David Githanda Washida, Deputy Governor, Kirinyaga County. Ms. Josephine Mwengi, the Deputy County Commissioner, Kirinyaga Central, and all the members of the county security team. Mr. Anthony Kimathi, the County Secretary. Honorable Claire Wanyama, the Deputy Registrar, Kirinyaga High Court. County Executive Committee members in the Kirinyaga County Government. Chief officers in the County Government of Kirinyaga. Mr. Tende Jero Muchiri, the Chairperson, Kirinyaga County Public Service Board. Mr. Joseph Murebi, the Deputy CEO, Bingwa Sacco. Mr. Timothy Muthike, the Deputy CEO, Fortune Sacco. Members of independent commissions and offices. Representative from various government agencies, religious leaders, representative for the student leadership from university and colleges, and all distinguished guests present. On my own behalf and on behalf of the County Assembly of Kirinyaga, I wish to welcome you for this state of county address. Honorable members, it is now my distinct pleasure and privilege to invite Her Excellency the Governor, Anne Waiguru, the Governor of Kirinyaga, to deliver the 2025 Annual State of County Address. Welcome, Your Excellency.
The Honorable Speaker, members, distinguished guests, residents of the great county of Kirinyaga, good morning. It is with gratitude and humility that I stand before this Honorable Assembly today to deliver the 2025 State of the County Address, which is both a legal obligation by the Constitution of Kenya, Article 183 and Section 32K of the County Governments Act, and a moment of thanksgiving and looking back on a journey of transformation, unity, and shared progress. This is more than a speech. It is a mirror reflecting our journey, a window into our shared future, and a drumbeat calling us to action. From the hills of Ndia to the hearts of Mwea, from our farmers and health workers to our youth and elders, we are the architects of our county reborn. Let this address be a celebration of what we have built, a reckoning of what we must confront, and a rallying cry for what we dare to dream. The story of Kirinyaga is not written by chance. It is written by courage, by community, and by leadership that listens, learns, and leads with commitment. Mr. Speaker and honorable members, on assumption of office in 2017, my administration envisioned a county where every resident can thrive and where dignity and prosperity are not dreams, but daily realities.
How perennial water shortages, impassable rural
minimum budget
allocations blueprint 2032 as the long-term development framework that would be our transformation journey. The best way to predict the future is to create it. Today we stand together as the county to affirm that we have created. On health, since 2017, Kirinyaga County Health Sector has undergone a transformative expansion under our administration, yielding tangible national recognition. An InfoTrack survey ranked Kirinyaga's health sector nationwide to be third in performance in the year 2024, reflecting higher user satisfaction. Multiple counties like Turkana, Kiambu, Nyeri, Machakos, Wajir, and many others have since visited Kirinyaga to benchmark on our model. The 341-bed Kirwea County Referral Hospital has been upgraded into a 5-story, 5-complex with critical care services, piped oxygen beds, modern laundry, incinerator, and a solar power system, and now operates almost at maximum capacity, currently serving roughly 600 outpatient and 400 inpatient daily, and serves 300 dialysis patients on a monthly basis. Additional hospitals at Kirinyaga, Kimbimbi, and Sagana are now in the process of completion and being upgraded to level 4 hospitals, where services will be decentralized from the county referral hospital for timely and efficient services to the residents. The county government has invested in expanding access to basic primary services by operationalizing new health centers across the county. This development has reduced travel time and healthcare-related costs for thousands of Kirinyaga residents by up to 40%. Back in 2017, Kirinyaga County had 65 operational health centers. Since then,
We have consistently grown our network of health centers and dispensaries with 20 new facilities, 12 of which are already operationalized, 4 which have already been completed and waiting for human resource, and another 4 which are nearing completion. Upon their commissioning, the total number of health facilities across the county will reach 85, marking a significant milestone in our journey towards accessible, equitable healthcare for all. These facilities provide essential outpatient services, antenatal care, immunization, and basic diagnostic, bringing healthcare closer to the people and enabling early detection and treatment without the burden of long hospital referrals. A prime example is Umoja Dispensary in Wamumu Ward, which now serves over 3,000 residents who previously had to walk more than 8 kilometers to access care at facilities like Siagini and Kiandegwa Dispensary. New laboratories at lower level health facilities now enable on-site testing for antenatal care, tuberculosis, HIV, diabetes, and other conditions, greatly accelerating diagnosis, treatment, and health outcomes. A standout example is the Riakethiga Dispensary Laboratory, which serves over 10,000 patients annually. It now offers on-site testing for TB, for malaria, blood sugar, where is operational, where pre-cancerous cervical lesions. We also vaccinate more than 32,000 girls annually against HPV, a main risk factor for cervical cancer. We have significantly enhanced the county ambulance referral system, streamlining medical transfers both within and beyond our borders. As a result, ambulance response time has dropped to under 40 minutes from dispatch to arrival at a public health facility. The investment in health sector has improved key indicators in the county, such as antenatal coverage has improved from 45 to 63%. The reduction of maternal mortality ratio has reduced from 88 to 55 deaths in every 100,000 live births. Neonatal mortality rate, number of children who die within 28 days of birth, has decreased from 26 to 10 deaths in every 1,000 live births. Skilled birth attendance proportion of mothers delivering in health facility has improved from 87 to 92%. Immunization coverage, percentage of children fully immunized by 12 months has improved to 91%. Mother-to-child transmission of HIV has reduced from 13 to 6.5%, amongst the best in the country. TB treatment success rate, percentage of successfully treated has increased to 89%, and it is also worthwhile noting that by November 2025, 64% of Kirinyaga residents were registered under the Social Health Authority. $150 health workers have been hired in addition to the cadres that are already existing. This includes general surgeons, gynecologists, oncologists, neurologists, orthopedic surgeons, pediatricians, amongst others. New specialized services that have been introduced in the county since 2017 include orthopedic surgery services, urology services, oncology services, neurology services, and epidemiology services, amongst others. Previously, residents had to travel outside the county to seek these services, often at great cost and inconvenience, leading to unnecessary deaths. Kirinyaga has also embraced digital health solutions to improve management and accountability. In 2023, Kerugoya County Referral Hospital went
completely paperless in all outpatient services, significantly improving service delivery. Now, all our level 4 hospitals, health centers, and dispensaries are equipped with an electronic health information system. This yields real-time patient data across health facilities, streamlining care coordination and reducing paperwork. The system is also integrated with the SHA system, reducing delays in claims submission to SHA and tracking reimbursements. Kirinyaга's achievements are underpinned by key health financing reforms, chief among them the Facility Improvement Fund, the FIF. Under the FIF model, each public hospital now keeps and manages its own revenue, user fees, and SHA reimbursement through facility-level committees and management team. In the past financial year, the FIF target was 237 million, which they surpassed with 213.5 million to collect a high of 431.5 million. As a result, hospitals can promptly repair critical equipment or pay for their electricity, casual wages without waiting for county allocation. On community health services, the county has engaged 854 community health promoters, distributed across 115 community health units within the county. In conjunction with the national government, the county has been paying the monthly stipend for the CHPs. These CHPs are linked to our public health facilities and have mapped households within their localities. They conduct door-to-door outreach on immunization, hygiene, non-communicable diseases, awareness, and make referral to clinics to provide family-level care. Health in Kirinyaga is not just a service, it is a promise. In Kirinyaga, we have kept that promise. We have built not just hospitals, but also equipped, hired healthcare workers, and purchased medical supplies to operationalize them. We have treated not just illness, but we have also restored the hope and dignity of the Kirinyaga people. Honorable members, Mr. Speaker, on agriculture. 8 years ago, our farmers were fragmented and each one toiled individually with little support. The sector was marred with poor access
avocado, apiculture, aquaculture, goats, and pig farming. We have supported 804 farmers groups with more than 253 to strengthen production and marketing. To enhance access to affordable credit and markets, the county established 20 multi-value chain circles in every ward and supported with 21 million for office setup, farmer mobilization, and financial services. As a result of these interventions, we have marked significant growth in agricultural production. For example, coffee earnings in Kirinyaga have seen significant increase, with some factories in 2024 and 2025 season paying between Kenya shillings 100 to 148 per kilogram of coffee cherry. The Koyoine factory in Kirinyaga County received the highest payout in Kenya of Kenya shillings 148 shillings per kilogram of cherry at the final auction of the 2024-2025 season. Gakani Coffee Factory was the second highest in Kenya with 145 shillings per kilo. Our coffee has continued to earn a place in the World Coffee Arena due to its good quality, and our Kirinyaga Slopes Coffee Brokerage Company, which we are supporting with the expansion of warehouses, is now among the top performer nationally. Coffee production stands at 42,000 metric tons, earning farmers 6 billion shillings annually. In Mwea, interventions in water distribution upon the completion of the Thiba Dam, farmers are now growing rice in 3 seasons compared to 1 season previously. As a result, Mwea Irrigation Scheme
is now Kenya's leading rice producer, accounting for approximately 80% of the national rice output, with a current total production of 210,000 metric tons, up from 90,000 metric tons in 2017. And this with an income of 15 billion shillings annually to our Kirinyaga farmers. Kirinyaga is also the leading tomato producing county in Kenya, with annual production rising significantly in recent years. The county government actively supports farmers by promoting high-yield varieties, providing capacity building, and establishing markets. These efforts have increased production of tomatoes from 46,000 tons in 2017 to 116,000 metric tons currently. This earns our farmers approximately 6.9 billion shillings annually. Dairy farming is also a significant sector in Kirinyaga, and farmers have been supported by improving cattle breeds through artificial insemination, enhancing animal feed production, disease control, capacity building for dairy cooperatives, and extension services. The dairy production has increased from 2.5 liters per cow to 7 liters per cow daily, translating to an annual production of about 86 million liters of milk, worth 3.1 billion shillings annually. Kirinyaga County's current avocado production is also estimated to be around 15,000 metric tons annually and valued at approximately 300 million shillings. The county government has implemented initiatives to boost production to increase this output to 21,000 metric tons, which could generate an upward of 700 million shillings to our farmers. In response to declining land productivity in traditional crop-dominated zones, Kirinyaga County has boldly embraced aquaculture as a strategic pillar of agricultural diversification. This shift has propelled the county to national prominence. Kirinyaga is now ranked 5th in fish pond production in the country. Fish farming has become more than an alternative livelihood. It is a lifeline for families, a launchpad for youth employment, and a cornerstone for our food security strategy. Through targeted support to over 510 farmers group, the county has rolled out the climate-smart fish ponds stocked with high-yield tilapia and catfish breeds, ensuring resilience and profitability. The impact is tangible. Annual aquaculture output has surged from 29.4 metric tons to 71.3 metric tons in 2024. To further strengthen the value chain, the county established a fish aggregation center in Kiaga, enabling bulking and preliminary processing of harvests. Today, this thriving sector generates approximately Kenya shillings 30 million annually for our farmers. Poultry production in Kirinyaga is growing, with a significant boost from the county government, which has increased egg production by 1 million eggs annually. The county government has supported this through construction of chicken houses and investing in an animal feed factory to produce about 220 bags of feed daily. Additional support includes the egg hatching business and a focus on improved breeds such as Kienyeji, Kenbro, and Kurot linkages, boosting incomes and reducing post-harvest losses for household needs. It is a driver of sustainable economic empowerment. Mr. Speaker, sir, and honorable members, on trade and investment, as we celebrate improved agricultural production, we acknowledge that our farmers still suffer post-harvest losses due to limited storage and processing facilities. To catalyze industrial growth and expand market access, the county has prioritized the development of the upcoming Sagana Industrial City, a transformative complex comprising an export processing zone, a special economic zone, and the affordable housing component, and a sports complex. This integrated development is underpinned by modern infrastructure, including reliable power, water supply, sewerage, and waste management system. The EPZ is currently at 60% completion and is designed to attract